Hello everyone, welcome back to the channel Ophthalmology on the Go. Today is going to be a session more specific for the first years who have just joined into ophthalmology residency, and we're going to discuss a few books that are integral to making sure that your residency turns out to be phenomenal and you become a great ophthalmologist. A few books that I used during my residency and how you can use them, and at what stage of residency and what stage of knowledge acquiring do you use these books. So first we'd like to discuss the PCSE series of AAO, right, the American Academy of Ophthalmology. They have 13 volumes dividing all the parts of ophthalmology into subdivisions. So I think this should be your base book. It is quite extensive. Reading the whole book is not necessary, but it is good to do. It is not required. It is not compulsory. Another book is Yanov. Yanov is also a book which covers the whole of ophthalmology, all the pathophysiology and everything in depth. I think you should definitely go check out Yanov. I checked out Yanov very late in my into my residency, and I realized that it is a vast book to cover, but everything in the book is given very beautifully. It makes sense. It's like a story, and it's very complete. So I really wished I had found Yanov a little earlier into my residency. Another book that I've not mentioned here is Kansky. Right? Kansky Clinical Ophthalmology. This was my base book during the whole of residency. Everything is given in Kansky in really short form, but it's complete. So it is a very good book for you to just go through if you want to cover everything in a shorter period of time, just before your theory exams maybe, and your practicals, just to brush up on everything. It doesn't explain everything in detail, but it gives you all the points that are required for you to write it in your exams. So my base book was Kansky, and then I kept adding stuff to it. Another book is Will's Eye Manual, which will help you a lot during your emergency opthal postings. And it's like a on-the-go book which you carry around everywhere. And for anything that you want to refer to, like a short glimpse you want to take of whatever disease or whatever pathology you've seen in your clinics, open your Will's Eye Manual, and it has all of it: the management, the pathophysiology, the signs, and the differentials that you look for in a patient of red eye or a patient with sudden onset diminution of vision, painful, painless, etc. The basic theory part, AAO, BCSC, and Yanov and Kansky. These were the three books that you can check out for your basic theory. Will's Eye for your on-the-go ophthalmology book. Now coming to specifics, there is for anatomy specifically, there is Khurana, which is by an Indian author, Anatomy and Physiology by Khurana. There is the Basic Sciences Practice by Forrester. So this one is the Forrester, and this one is Remington. Remington. Okay, so for anatomy and physiology, I would recommend that you start with one of these three books. So Forrester and Remington, both of them, they go into the depths of everything: the anatomy, the physiology, and the biostatistics, the biochemistry, and all of it. So for understanding purposes, Forrester is really good. Remington is also a good book, and just go check out these books. But if you want something which is just absolutely to the point, just to write answers, just to mug up, and you don't want to go into the details of why, how, when things are happening, I would suggest you go look at Khurana. I wish I had read a little more from Remington. I did go through Forrester, but I found it very extensive. It is usually the book recommended if you want to give exams like ICO, FICO, or FRCO, or some all of those exams. And Khurana is a staple for your for your theory exams. Another book from Khurana is the Optics and Refraction. This was something that I referred to for my theory exams, the optics and refraction part. And for optics, if you want to know the why, how, when of optics, then there is another book called Elkington Optics, right? Optics by Elkington. This is also one book. If you want to go into the details of optics, refer to Elkington's. It's nice, you will understand stuff, you'll be better able to retain it. I personally really liked Remington. I personally really liked Elkington, and yeah, but for my theory exams, I did refer to Optics by Quran. So that we are done with anatomy, physiology, and optics. So now moving to the subspecialties. First, we'll be covering glaucoma. Glaucoma has two books which are like standard. One is the Shields glaucoma and the other is Becker-Schaffer. So both of these books are really amazing. One thing that I did, and I'm really thankful that I did it, was read the first few chapters of Becker-Schaffer, which gives like the basic introduction of glaucoma, the examination, the HVF, all the basic stuff. I think it's the first 10 chapters or so, which is like the introduction chapters of glaucoma. So I did read that from here. And for the rest of it, the rest of glaucoma pathologies, I referred to Shields. So I would recommend you do that too. And for retina, as a subspecialty is not very properly done at a lot of places. So a standard book for retina is Ryan's Retina, but it's too vast, and nobody really teaches that much retina, so you don't need to go into the depths of retina from Ryan's. There are other standard books, but Kansky and AO and Yanov mostly cover everything. You don't need to figure out another book for the other subspecialties. I only used for glaucoma. And for the surgical aspect, there is a small incision SICS surgery, manual SICS surgery manual by Arvind, right? So I had used this book initially to figure out. They explain very nicely all the hand placements, the hand movements, the holding of the instruments, why we're doing a step, how we're doing a step, with what instrument, what size of instrument are we doing it, what complications can we expect, what precautions to take during practicing a specific step in the surgery. Right, so I would recommend, if you're starting out with your surgical training, then you should refer to this book of Arvind Eye Hospitals, the manual, small incision cataract surgery manual. There are a lot of other books which are not extremely essential, so I'm not discussed all of them in this, but these were a few of the books that have really helped me throughout my residency. It's very difficult to finish even just one of these books. It has been a mixture of everything, but I would recommend that you have one base book, and to that base book you keep adding your extra information. And this process of having a base book and adding extra information is easier when you do it on your electronic device, your iPad or tablets. So if you're not familiar with how to use your iPads and tablets, I would recommend start getting a hang of it, start using it, and if you can afford it, buy it. I would say it's an investment. It's not an expenditure that you're doing, it's an investment. It's going to make your residency so much easier. So yeah, those were the books that I have used, helped me through residency. I hope it helps you too. If you have any doubts, any questions, any books you want me to recommend for specific subspecialties in ophthalmology, do let me know in the comment section. And yeah, all the best. Bye bye.